Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Pondering, and this audio podcast is part of the series, the Bostix, Blitzar, and the specials. This audio podcast series, as part of the Convey and Maverick, and this audio podcast is part of a ZtormLabostix production. Excuse me. Through this audio podcast, in and around works, looking at a in on a patient case, in on a patient case, looking at the neurological condition, Parkinson's, in around a male patient. This audio podcast will now look into or go into where our Goodwin looked at some of the investigatory aspects of the condition. So a meta benzyl guanidine scan or MIBG investigation, or radio what's referred to as a radio diagnostic investigation or investigation have been used to image and treat a range of or have been used to investigate a range of neurological malignancies, such as neural crest tumors, ganglioneuroblastomas, and medullary carcinomas. And there are two methodologies of uptake for MIBG, and that being passive and active. Active uptake sort of has the basis of sodium and energy dependent, following the monoamine a monoamine pathway, and the and acting, and where it has an acting basis similarly to where norepinephrine has a settling, or has a basis in around the neural granules, which are in around the neural granules in neural granules, at wherein abnormalities can be investigated with the use of MIBG, but where there is additionally a sort of a fluorescence basis, wherein particular parts of malignancies, for example, can be imaged through can be imaged or viewed in where those parts of the neural bases can be fluoresced, or where there's fluorescence in as part of the investigations in around where abnormality or anomaly can be viewed. And the active methodology is preferred over the passive, however, as it has more precise and more effective, according to some literature. Due to patient X's initial analysis, initial initial analyses of the MIBG imaging that had been initially sort of negative. There at the same time there was a possibility of sort of mass of sort of masses masses or growth in around parts of the central nervous system, or part of the brain, in at least some part. But at the same time, the at the same time uh, uh, at the same time where at the same time in a part of the in as part of the investigations, or MIBG scan or imaging, there had been some indication where there was additionally insignificant or little or low and unlikely basis, where the symptomologies that patient X had been experiencing or had experienced was the cause of sort of the underlying sort of pathophysiology. So another useful in diagnostic test or investigation is a radiological, a sort of another radiological form of imaging referred to as computed or computerized tomography scan, or CT scan. And a CT scan can be useful can be useful or helpful in identifying structural abnormalities, tumors, and also associated atrophy, especially for example, in Alzheimer's conditions. So while CT scan is less precise to an extent, and therefore may miss, for example, the smaller lesions, it further elucidates that tumors are not often the cause. That tumors were not the cause, or had not been the cause of patient X's symptoms, and thus rules out Alzheimer's, for example, as a probable cause. Furthermore, patient X's acetylcholine, or ACH, abbreviated in much of the literature relating varying neurological conditions, and acetylcholine being a main neurotransmitter. In patient X's case, it's where the acetylcholine, or ACH, investigation had revealed that it was within the normal laboratory reference range. And due to the ACH being a sort of crucial or important neurotransmitter, at the same time, it was aware in patient X's case, it was where the analysis had propagated a negative diagnosis of Alzheimer's and other sort of dementia or epileptic sort of conditions, and or tumors. Additionally, our Goodwin informs that ACH is additionally an important neurotransmitter, and additionally, where dysfunction or anomaly anomaly of ACH can in some cases be a hallmark of Alzheimer's, and also aspects that are referred to as Lewy bodies, dementia, and epilepsy. Additionally, uh, additionally, uh, uh, additionally, therefore, it is where in patient X's case, the initial sort of radiological radiological investigations had shown or informed that acetylcholine analyses again had been at normal level, or had been at normal titer. Um, that draws this audio podcast to a close. This audio podcast is part of the Pondering. This audio podcast is part of the Bostix and Blitzar and the specials. This audio podcast as part of the Convey and Maverick, and this audio podcast as part of a ZtormLabostix production.